Bleeding during pregnancy creates anxiety to every woman. Imagine someone has been struggling to get pregnant and all of a sudden they are bleeding. In this video, we'd like to look at what causes bleeding during pregnancy and how you can treat and prevent bleeding during pregnancy.
Ask Dr. Othman Osawowo.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private chat, a private conversation, go to my website www.drothman.com, book an appointment. I'll be right there to chat with you privately because I know some of you wouldn't want to ask questions in public, and that's why I care for you. Now, for those of you who are viewing this channel for the very first time, please do not forget to subscribe and also press the notification bell in order to be notified of any important videos we upload. And today we are talking about a certain monster. Why am I calling it a monster? Because a woman struggles to get pregnant. Someone has spent 5 years without getting pregnant, and once they conceive, they see blood. Bleeding during pregnancy is our topic today, and we'd like to know what are these common causes of bleeding during pregnancy? How can you know their causes? And again, how can you treat them? So, bleeding during pregnancy is our topic today, and you can follow us on all our social media platforms. The name is Ask Dr. Othman. You can go to YouTube, TikTok, you can go to Facebook, every social media channel, we are there, and it's Ask Dr. Othman. Right away, what is this monster called bleeding during pregnancy? I have told you that when a woman conceives, we do not expect blood because a woman has been undergoing menstruation on a monthly basis. Okay, has been undergoing menstruation on a monthly basis. And actually, one of the signs to show you that probably I am pregnant is when there is no longer menstruation, or what we call amenorrhea. Actually, most women get to know that they are pregnant when they miss their periods. Therefore, when you see blood, it looks a bad sign. Okay, so now, what mostly causes this? Number one, we are going to categorize this bleeding under 3 headings. And these headings will be under the first trimester, second trimester, and third trimester. What do I mean by first, second, and third trimester? When you look at the pregnancy, it is divided into 3 phases. Because now let's go to our common knowledge. You usually say a woman gets pregnant for 9 months. Okay, the gestation period of a woman is 9 months. Therefore, we divide those 9 months into 3 parts. The first trimester, that is the first 3 months. Second trimester, the second 3 months, or that is the 6th month. And then the third trimester, that is the period between the 6th month and the 9th month. So we are going to look at to categorize those bleedings under those headings. Now, what happens if a woman bleeds during the first trimester? What I mean is that bleeding in the first 3 months of pregnancy. What happens? You should know that some of this bleeding is normal. For example, the implantation of bleeding. Up to 25% of women after conceiving the 2nd week, they get that spotting, which is called implantation of bleeding. What happens is that you remember during fertilization, I think you remember this common biology. I usually show you here. Okay? I usually show you this very common basic science. I usually tell you that when we have, during ovulation, a woman's egg will move and come around here. This region is called the ampulla. And then when a woman involves herself in unprotected sexual intercourse, a man will deposit sperms here. Okay, so sperms will swim through the cervix, the uterus, and they will find their way into the fallopian tube. And when they reach the fallopian tube, they will fertilize this egg, and this will become a zygote. Okay, this zygote will only spend 80 days. It will only spend 80 days in the fallopian tube at the region of the ampulla, and then it will start moving. So, it will start moving it will migrate from the fallopian tubes into the uterus, and therefore it will find its way into the uterus at the wall of the uterus, and it implants itself here. What is implantation? It's like trying to attach itself onto the uterus. Now, during that process of this zygote of your baby, the younger you attaching itself onto the uterus, onto the walls of the uterus, there can be bleeding or spotting. Where does it come from? Of course, you know this process, okay, will involve either injury to the uterus or injury to this small human being that is being formed, and this will cause some bleeding, and this bleeding will be seen as spotting. So when you are pregnant in those first 2 weeks and you see some little blood, don't get scared. That is spotting, which is as a result of implantational bleeding. So that shouldn't worry you. There can also be bleeding in the first trimester, which is caused by cervical changes. What do we mean? You know, when a woman gets pregnant, there is a way, there is a hormonal interplay. And this hormonal interplay will bring about many changes in the body. And some of the changes will occur at the region of the cervix, here, at the cervical region. And this will lead to development of blood vessels. Okay, the blood vessels, we shall have increase in the number of blood vessels and also increase in the blood flow to the cervix. And these changes, the increase in blood flow, increase in the number of blood vessels can cause bleeding. And therefore, we can have cervical bleeding, which is as a result of the cervical changes, as a result of the hormonal interplay during pregnancy. This can also happen in the first trimester, and it shouldn't also worry someone. However, it needs a medical attention. The first one doesn't need a medical attention, implantational bleeding. You don't need it. But this one needs a medical attention, because if these vessels are big or if the bleeding is really severe, then it has to be dealt with. Another issue can be miscarriage. My friend, that's why I call it a monster. When you start bleeding during pregnancy, it can be a sign that you are going to get a miscarriage, that abortion is occurring. And usually there are many causes of abortion, of course, but especially in the first trimester, it can be as a result of hormonal imbalance. Hormonal imbalance or any issues with low levels of progesterone, etc. So when you see bleeding, and especially when this bleeding is associated with pain, whether it's mild or those cramps. You have some cramps, you're seeing blood, and then you have cramps. That bleeding needs attention of a doctor, because it may be a sign of miscarriage. Then another cause of bleeding during the first trimester can be infections, the usual ones, okay? The usual infections, it can be as a result of cystitis, it can be a PID, it can be an infection of the cervix, infection in the endometrium, and so on. Those infections can also cause bleeding, and those ones will also need attention. Now, what about in the second trimester? What happens? Now, in the second trimester, we can also have bleeding. And usually, bleeding in the first trimester may not be lethal. But for bleeding in the second trimester is a little bit dangerous. It's more dangerous than the bleeding in the first trimester, except with abortions. Now, bleeding in the second trimester can take another step. There is some animal called placenta previa. What is placenta previa? You see, when you have your uterus, okay, let's draw it again. You have your uterus here, and the baby is here. Let's assume this is Miss Mary in the womb. This is Miss Mary. Now, when you look at this Miss Mary has a placenta. Okay? Has a placenta. How am I going to draw it? But a placenta has a placenta. Maybe let me draw it somewhere here. Miss Mary has a placenta, and then this is the cord. Okay? Drawing is becoming a problem. But this is what I can explain. When during pregnancy, the placenta is supposed to be up. Okay? Because we have the cervix here, we have the womb, and the baby is supposed to be here. So usually the placenta is the one that feeds the baby. Okay? It is the one that feeds the baby. We get blood from the mother and nutrients, then to the placenta, and then to the baby. Now it's supposed to be up. It is not supposed to be near the cervix. Okay? It's supposed to be in the upper walls. Okay? Around here. Okay? This placenta is supposed to be around here. But in cases where this placenta lowers itself down, instead of being up here with the baby, for it comes here in front of the baby, and it is in the upper, at the lower end of the uterus or at the upper end of the cervix. This is what we call placenta previa. So, in most cases, they will tell that there is a low-lying placenta, that the placenta has lowered itself in the lower end, at the lower end of the uterus, and that is called placenta previa. That will cause bleeding during pregnancy. Another issue can be placenta accreta. What is placenta accreta? This placenta is not supposed to be embedded into the walls of the uterus. I think I'm now becoming too biological, but let me make it simpler. When you look at this uterus, it has walls, okay? It has 3 walls, okay? The endometrium, the myometrium, and this outer layer, okay? Now, this placenta is supposed to be out, it's supposed to be within the uterus, in the endometrial region, in the endometrium. However, at times you can find that it has entered into the walls, into the myometrium. Okay, it has entered into the walls of the uterus. This is called placenta accreta, and it will cause bleeding. Then we can also have an issue to do with cervical inflammation. Anything that can cause inflammation of the cervix, be it the other changes we talked about, which are as a result of the hormonal fluctuations, or anything that can cause injury to the uterus, to the cervix, can cause cervical inflammation, and that will also cause bleeding. Of course, infections, we can't forget infections, can also lead to cervical, can also lead to bleeding. Now, another monster is miscarriage. Yes, a miscarriage can happen in the first trimester, but can also happen in the second trimester. And common causes of miscarriages in the second trimester can be as a result of what we call cervical incompetence. When this cervix is incompetent, that's why you saw that during when a woman conceives, this cervix gets supplied with a lot of blood by increasing the vasculature, the blood vessels, and also increasing the blood flow to the cervix. This makes the cervix strong. It gives the body of the cervix the strength so that it can maintain the fetus. However, if that does not occur and you have a short cervix, you'll end up not being able to cover the hole, and therefore you can have a miscarriage, and that will cause, of course, bleeding associated with lower abdominal pain. Now, that is bleeding in the first trimester and bleeding in the second trimester. Now, how about bleeding in the last trimester? That is the third trimester. This is when really the fetus is grown and the woman is about to give birth. What can cause that is abruptio placenta. All these terms are very big. Abruptio placenta. We said that this placenta is attached to the wall of the uterus, but the outer wall, that is the endometrium, okay? In placenta accreta, the placenta embeds itself into the walls, inside the walls of the uterus. I don't know if my people will understand. In placenta accreta, we have Okay, normally, we are supposed to have this placenta here attaching itself onto the outer layer, the endometrium, onto this wall of the uterus. In placenta accreta, instead of attaching itself here, it enters the muscle of the uterus. Okay? Now, in the abruptio placenta, this placenta had attached itself very well normally, but now it is breaking away. It is breaking away. It is getting detached. This is the placenta. This is the wall. They have been embedded and now it's getting detached. That is what we call abruptio placenta. Of course, because the other time it had embedded itself, now detaching itself will cause bleeding. Another cause of bleeding can still be placenta previa, the same thing that happens in the second trimester, whereby this placenta comes and occupies this space. And this will cause a bleeding, like I've explained, in the second trimester. Then another one can be as a result of a shock. So it shouldn't worry you. What is a shock? It is the first sign of labor. Okay? So you may see blood, but it is a sign that labor has started. You are about to deliver. So that is not a big issue, but you should also know that when you see bleeding, especially when you are about to give birth, okay, just a few weeks, just know that it can be a shock, which means the beginning or starting of labor. Another cause can be uterine rupture. This is very dangerous. Actually, this is lethal. This is life-threatening. Uterine rupture is a condition whereby your uterus ruptures, whereby your uterus bursts. It bursts. And this usually happens with women who have had previous scars, who have had, you had a cesarean section in the last pregnancy. You delivered by cesarean section. Then in this second pregnancy, you can have a uterine rupture. And it usually results as from women who get pregnant earlier than advised. Usually, when you deliver by cesarean section, we tell you to spend at least 2 years before conceiving. Minimum, actually, we give 18 months. That is 1 year and a half. What happens? Some women, after having a cesarean section, they will conceive in 3 months, in 6 months. Of course, pregnancy will occur, but you are at a risk of uterine rupture. That is not the only cause of uterine rupture. We can have other causes of uterine rupture, like prolonged labors and so on, but that is the main cause of uterine rupture, and that will cause bleeding. That one is life-threatening. It is an obstetric emergency. When we detect any sign of uterine rupture, you must be rushed to the operating theater for an emergency cesarean section. Now, another cause can be infections. You know, infections can happen everywhere in any trimester. It can be in the first trimester, second trimester, third trimester. So even here in the third trimester, infections can happen. Also, cervical inflammation. The inflammation of the cervix we've been talking about in the second trimester can also happen here, and I guess you know what brings about cervical inflammation. And lastly, which can happen in the third trimester, is preterm labor. Preterm labor. So when there is preterm labor, you can start bleeding. A woman can start bleeding. What is preterm labor? Preterm labor is when labor starts, labor starts before its time. Before the term, before the baby is mature. We consider a baby to be mature at 37 weeks. So full term is 37 weeks. 37 weeks, a baby is at term. Now, if labor begins before 37 weeks, we call that preterm labor. And that can cause bleeding in or during pregnancy. We've seen all that. We have seen all that. Okay? We've seen the causes. But I think the main question with you is that, how will I know? How will I know that the cause is this? Because we've seen many causes, there are very many causes, but how do you know that this is exactly the cause of my bleeding? How do you differentiate a miscarriage from a placenta previa? How do you differentiate placenta accreta from placenta abruptio or abruptio placenta? How are you going to differentiate this? Now, what you are supposed to do is to go to the hospital. What will the doctor do? The first thing is a physical examination. The doctor will try to examine you using his hands, okay? Will examine around, and during that examination, they can discover many causes of this bleeding. And one of the exams that will be carried out is speculum vaginal examination. What the doctor will do, will get a speculum, or will get an instrument and put it under or inside your vagina, opens and checks. By opening, you are able to see whether it's the cervix which is inflamed. You can know. You can see many things when you use speculum vaginal examination. You can see clots, you can see some product. You may even see that there is an abortion because the cervix is has opened, and I'm already even seeing the fetus in the cervical canal. So therefore, this is an abortion. So physical examination, especially by manual vaginal examination, can really give us causes, can really explain to us why someone is bleeding. Another one which can be done, another test, is sepsis screen. A doctor will try to do sepsis screen. In sepsis screen, they will do urinalysis, a urine test, they will do a CBC to check if you have any infections. They can do swabs, they can do many tests around there to find out if you have any infections that are affecting you. And then, of course, an ultrasound scan will have to be performed. And if this ultrasound scan is performed, especially, it can be able to show us whether the cervix is open, the internal os, okay? It can show us that there is a low-lying placenta. Because with an ultrasound scan, you're able to see that, we are supposed to see this placenta here, but it is instead here. Therefore, this is placenta previa. Then it will tell you, this placenta is supposed to be attached itself on the wall of the uterus like this. But now, it has entered into even the other layers of the uterus, which will show us that it is placenta accreta. It can also try to tell us that, you see, at first, this placenta was attached here, but now it is detached. We don't have a connection between the wall of the uterus and the placenta, and we shall know that that is abruptio placenta. Therefore, an ultrasound scan can also be able to show us what is happening. Sometimes we can also do a rhesus factor to check the rhesus factor incompatibility, which can show us that someone probably is having a miscarriage as a result of rhesus factor incompatibility. Then also, in such, we can also carry out, especially if we do all that, we are talking about everything looks normal, we are not able to see the cause, then you can do what they call fertility hormonal assay to find out the levels of progesterone, because sometimes when progesterone goes down, a woman can start bleeding. Now, how do you treat? How do you treat? Because I know the interest of a woman is to know what is causing bleeding when I'm pregnant. That is number one. But number two, how can I get rid of it? How can I treat it so that I can remain with my baby? Now, we start with implantational bleeding. We said with implantational bleeding, do nothing. Do nothing because it's normal. We've already seen it. Two, if you find out that it is placenta previa, when you find that it is your placenta which is lying lower, in the lower end of the uterus, okay, what we shall tell you is to have complete bed rest. Complete bed rest. And when we say complete bed rest, you see, when we usually tell women to do complete bed rest, and what they do is to only leave work. Okay, I've been working at a petrol station, I've been working in the hotel, I've been working in certain restaurant, I was working somewhere, now let me go back home. So that's what they think, it's called bed rest. They leave work, and when they reach home, they are mopping, they are sweeping everywhere, they are washing dishes, there are many things that will not be bed rest. By bed rest, we tell you, go sleep. You rest. the only activity we want you to do is to go to the toilet, do susu, do poo-poo. That's all. Susu, poo-poo, eat. Even sex is not allowed during bed rest. So when we say do complete bed rest, we are saying no sex, no activities, only eat, drink, sleep, go to the toilet, and that's all. That is complete bed rest. Then we do that complete bed rest, but we also continue doing serial ultrasound scans. So we do track, we still continue tracking this pregnancy. We do several ultrasound scans on timely basis. So the doctor will schedule, will tell you, okay, go and do bed rest, spend 2 weeks, come back. Go and do bed rest, spend 1 month, come back. So that's how the doctor will manage that. If it is severe, if this placenta previa is severe and the pregnancy is at term, we order for cesarean section. Because remember, this is putting you at a risk of losing this fetus, of bleeding, and so on. So we plan for a cesarean section. A woman with placenta previa is not advised to go for normal vaginal delivery. Why? Why? Because this actually, this has always put me in a dilemma with most of my patients. I have to explain it. Maybe some of you who will see it and you got the doctor, you not give your doctor a hard time. I want to explain this to avoid you people giving a hard time to your doctors. If you have placenta previa, okay? You have placenta previa. It means that the placenta is here. Okay? This is the placenta. And now where is the baby? The baby is here. My drawing. So this is the baby. The baby is facing down. This is the head. This is the chest. These are the legs. Now, if the placenta is here, how are you going to deliver normally? Where is this head going to pass? Because there is already the placenta. The placenta has covered the opening, has covered the cervical opening where the fetus is supposed to be delivered from. And really, when a woman is pregnant, sometimes they don't have a decision to make, but you have to explain the relatives. It becomes so hard because the woman, they will tell you, but even last time she delivered normal. This is the 4th pregnancy. She has been delivering well. Doctor, why are you taking us for cesarean section? And you find yourself explaining from morning up to the following day. But this is the issue. Please understand it. The placenta. Why I also want to add, to emphasize this is that we've lost many women because of this. What happens? You tell the woman that the placenta is low-lying. It has covered the whole area of the cervix. The baby cannot pass. Therefore, we are going to do a cesarean section. They say, okay, all right, doctor, let's come back in the evening. Let us plan for this in the evening. You know what they are going? They are going to traditional birth attendants. Because this should just be common knowledge. Even if you are unexperienced, you have 200 years in delivery as a traditional birth attendant, how are you going to deliver this baby? Are you going to first pull the placenta? Okay, so you're going to waste your time there, and you will enter labor, bleeding will start. By the time they bring you back to the hospital, kaput, you're gone. And that's why we want to emphasize this point, that when there is placenta previa, it has persisted and it has covered the whole part of the cervical canal. Then, and also, you are at term, we recommend for a cesarean section. Please always accept those recommendations because they are good for you, for your health. Now, if this bleeding is severe, then and it has caused anemia, then we may need blood transfusion for this person. Therefore, the doctor may tell you that we are going to give you blood. We'll start testing different blood to find which one is compatible with yours, and then they will transfuse you because there is too much bleeding. Now, if it's abortion, and when we talk about abortion here, you know there are two things. We have what they call a complete abortion, actually. We have what they call threatening abortion or threatening miscarriage. We have what we call the incomplete abortion. We also have a complete abortion. If it is threatening abortion, it means that abortion is pending to occur. There are signs that abortion is going to occur, though it has not yet occurred. Signs like bleeding, signs like pain, and so on have started occurring. However, the fetus is still alive or is still live. There is a live fetus, but pending to die. And that is called a threatening miscarriage. It is threatening to occur. Incomplete miscarriage, the fetus is already dead. There is no life there. However, and some products have moved out. However, there are still other products. Like the placenta may still be there, or the cord, whatever. But the fetus is dead, though everything is not yet out of the uterus. With a complete abortion, everything is out of the uterus. Now, we are talking about threatening miscarriage. This is what you can, in other words, what you can manage, or what you can you can help a woman if they are having threatening miscarriage to remain with their babies. How? Identify the cause. Try to find out what is really causing this. It may be a simple infection like a UTI, like an endometritis, like whatever, vaginal infections and so on. Treat them immediately. But it may be cervical incompetence, especially the miscarriages that happen in the second trimester. The woman is 3 months pregnant, 4 months, 5 months. That is likely to be cervical incompetence. And this is seen on an ultrasound scan and also vaginal examination. So you will be able to observe that there is a short cervix and it is weak. Okay? So you measure its thickness and its length. And that will be able to hint to you that there is cervical incompetence. And what will you do? Mark, don't let this stitch. Stitch that cervix. How? This cervix is opening. It wants to let the baby out. What are you going to do? Get a stitch, attach this wall onto this wall, this wall onto this wall. Covered. And therefore, the baby will remain inside. And these stitches can be removed during labor. Or when you reach term. So that is how we are going to manage. However, if you test, if the cervix is okay, everything is okay, then you test the levels of progesterone and you find that there are low levels of progesterone. You know what to give. Give progesterone supplements. Give medicines that contain progesterone. There are tablets, there are injections like microlute, injections like primolute, and so on. Give them to the woman. The woman will not be able to lose their pregnancy. Those can be the causes of bleeding during pregnancy. If it's your very first time to watch my video or to watch my channel, please do not forget to subscribe and also press the notification bell in order to be notified of any important videos we upload. And for those of you who would like to have a private chat, private conversation, go to my website www.drothman.com. Book an appointment. I'll be right there to chat with you. I sign out. Have a lovely evening.
Ask Dr. Othman on Sawa War.